So we've talked in the past about different things you've tried, and I know you've done hyperbarics. How has that helped you?
Oh man, that I think that's something that's completely overlooked. I actually own a hyperbaric chamber. I bought it probably 3, 4 years ago. It was a $5,900 investment. I wrote it off of my taxes as a medical device, and man, I can tell you, it's the fountain of youth. It's just oxygen, so there's no fancy, there's nothing fancy. There's very few contraindications for it. Consult with your medical professional if you're interested in using it. But it's essentially adding extra oxygen to your body, which can speed recovery. The actual term is called hyperbaric oxygen therapy, HBOT, and you can Google HBOT and all kinds of different things, and you'll find peer-reviewed research, medical research. They use them. It's been used not only in the United States, but Israel's used them quite heavily. And there's tons of research that can help with injury recovery. Like for instance, I'll get tattoos and stay the night in a hyperbaric chamber. It'll seal my tattoo overnight. I've it's really helped my lower back. I ended up getting stem cells, which is another great, non-traditional approach. And I use my hyperbaric chamber in conjunction with my stem cells, which I haven't had back pain at all since I got that. But as far as hyperbaric oxygen therapy, it's phenomenal, man. I think, I also use a sauna and a cold plunge as well. I'm into all that stuff. I think, there's tons of studies on it. And again, if you use Western medicine as an anchor for your issues, you're going to get surgery or pain pills eventually. That's just kind of how it works. And I just didn't want those things anymore. I didn't want to be on any medication. And I really didn't want to get surgery, especially in my back. My back pain, obviously wasn't as debilitating as yours, Mark. But it was just a constant nag. And I got tired of it. So I just did some aggressive non-traditional means, and it's really paid off for me.
Yeah, and I had that constant nag in my lower back since my late teens, early 20s, and every once in a while the I would get the herniated disc or the slip disc, and where you're just walking with real tiny steps, and I would take care of that with the inversion table. And then this last time, it just, oh, I'll get it. I'll hang more on the inversion table. It just got worse and worse, dude.
Well, and
Um,
I think once the disc gets slipped and that fluid gets on that nerve, sometimes you can do the inversion table to pull the spine apart for it to go back, but sometimes it can get all the way out. And yeah, man, that pain is real. That's a real thing.
yeah, dude. With your hyperbaric chamber, is it like a negative pressure chamber where it's forcing the oxygen in, or are you wearing the nasal cannula, or what do you?
Yeah, both. So you're wearing a nasal cannula, right? You're hooked the oxygen the hyperbaric chamber is hooked to both an air compressor and an oxygen concentrator that runs into the tube, and it's just a big long tube. So the tube fills up, it gets to pressure. I don't know the exact pressure, but it's as far as your ears, it's like you're flying on an airplane, so you'll have to clear your ears a couple times, and then you're wearing a nasal cannula, or you can wear a nasal cannula, or you can wear a mask. I just wear the nasal cannula, but yeah, it's forcing that oxygen into your tissues via the pressure. So you're actually breathing in oxygen, and it's also forcing oxygen into your tissues. Kind of similar to that, Lance Armstrong was blood doping. He would pull his blood out and put his own blood back in. And my understanding of why he was doing that is to get extra oxygen in his blood, because there is a healing property to it. And yeah, I mean, my wife ran a 26-mile marathon, stayed the night in the hyperbaric chamber, and woke up the next day like she'd never run. My daughter had a boxer fracture in her hand. I stuck her in there for 4 or 5 straight days and it fused a bone. I had a heart surgery where they were placing a stent, and the doctor nicked my radial artery in my forearm, and they wanted to do a forearm fasciotomy. Fought my way out of the ICU after the stent placement, stayed the night in the hyperbaric chamber, and it sealed my artery. Like, yeah, that thing's pretty magical, man.
So we're talking about when we walk around and breathe, it's like 21% oxygen. But when you're in that chamber, is it 100%? Is it 99? It's somewhere in there, right?
Mark, that's a good question, and I don't want to say the wrong answer. I definitely know it's definitely forcing a much higher oxygen concentration. I know it's working because I'll put a pulse ox on my finger, and I'm normally sitting around 98%, and every time I put the pulse ox on in there, it's 100%, which is probably the only place that I ever get 100% oxygen. But I don't know. I don't know. I'll actually get back to you on that though, because now I'm curious myself.